Hello everyone. Today's video is about a topic I get asked about all the time, ADHD. And so I hope for this to be a quick review of ADHD, both the diagnosis and the treatment. This is not comprehensive, of course, and as always, you need to consult your child's own pediatrician about any concerns you may have. So first of all, let's just start out with definitions. A lot of people still call this diagnosis ADD. That is what it was called. But years ago, we switched the nomenclature to ADHD, so Attention Deficit Hyperactivity Disorder. But the thing is, you can have the inattentive type only, or the hyperactive type, or what we see most often combined, which means that the child is both inattentive and hyperactive. So that's just a nomenclature thing, logistics, we call it ADHD with or without the hyperactivity component. Now, on average, but not at all every single case, on average, you're more likely to find little boys that have ADHD with the hyperactivity, and often girls may have the inattentive type only, and often they come to diagnosis later because they just sit in the classroom, they're daydreaming, their mind's a million miles away, but they don't get in trouble because they're not physically hyperactive or fidgety, they're not up out of their seat, so they may be later to come to diagnosis. Now, this is a controversial topic, only in that many people come up to me and say, isn't that overdiagnosed all the time? Well, it can be overly diagnosed, certainly, especially if a full evaluation is not done. So most of the time you'll find that any good practice worth their salt requires a complete psychoeducational evaluation before beginning medications for ADHD. And we definitely do that in the practice where I work. And then if the child is diagnosed, we always remember that that child has higher risk of what we call comorbidities, such as anxiety or depression or oppositional defiant disorder or other behavioral problems. And so primary care pediatricians are comfortable managing ADHD, managing the medications to treat that, unless we run into additional comorbidities, and we often would feel more comfortable in those situations referring that patient out to a pediatric psychiatrist. So if you have concerns about your child, first of all, you should know most of the time for this diagnosis, the children have had issues since the age of 4. The issues, the symptoms present in multiple different settings, and that could be difficulty focusing, easily distracted, poorly organized, rushes through their work, very impulsive. They're characterized by impulsivity. That is, they leap before they look. They say something before they think about what they're going to say. And so you could see where those characteristics symptoms would cause all kind of issues with academic settings. And so it is extremely rare for us to start medicines before the children are in school. So the earliest I think I've ever done it was right at kindergarten. But most of the time, kindergartners are also very impulsive and physically fidgety and hyperactive, that they don't come to an official diagnosis till 1st or 2nd grade often. And so maybe the kindergarten teacher was concerned, told the parent was already concerned, they asked us about it, and then we would recommend this complete psychoeducational evaluation. Okay, so let's say you've been through those steps, you have the concerns, you get the workup done. It's usually done through a psychologist, and there are a lot of different groups, especially in large cities, multiple groups who are capable of doing this evaluation. So the tricky part is finding which one is compatible with your insurance. Some psychology groups will do the whole workup, bill you, you then submit your receipt, your bill to your insurance company, and you get reimbursed. So you do need to investigate that a bit before you get it done, because they can be pricey. I had a mom the other day say that her son's workup was about $1,500, and unfortunately they had to pay out of pocket. So it's worth your time to investigate through their website or through your own pediatrician's recommendations which local groups are compatible with your insurance. So let's say you've had the evaluation done. You come back to us, the primary care pediatrician, with this complete eval, and it's usually multiple pages long with very specific suggestions on the back, which is awesome. It's good to get this complete workup because they also look at IQ, they also look at processing disorders. It's a very valuable thing to have done in general. And a lot of parents even say, remembering our childhood perhaps, I don't want my child to be labeled and for that to follow him through the school system. Well, that's not really the way we look at it these days, because within at least public education in the United States, if your child has a specific thoroughly, completely evaluated diagnosis that's believable, legitimate, on paper, that can qualify your child for things, especially if they need an individualized education plan or IEP. And then once you have that IEP, so for ADHD, for example, the IEP may say, my child needs a distraction-free test-taking environment. So once you have that IEP in hand, you can get more services for your child and hopefully help them accomplish more in the school system. So is it to your child's advantage to have a diagnosis if they already have the disorder? Usually yes. And plus then we know how to treat them. We're not going to use medicines for ADHD if that evaluation didn't diagnose that disease, that disorder. And so if you come back with us though with that full eval, they do have the disorder, we will talk about medications. The standard of care initial treatment for ADHD in the US is extended release stimulant. Now this is where most parents say, wait, we have this child who is completely, wildly energetic. Really, I don't think he needs a stimulant. But incredibly enough, it's the stimulants that help that child focus, achieve some control over their impulsivity, achieve better grades in school if they can control their disorder. Because remember, I hope you understand this, IQ and ADHD are two separate categories. You could be brilliant and unfocused. You could have cognitive delay, very low IQ, and still have ADHD. They're two different things. And so the way I think of it is, if your child, by their God-given IQ, genetics, wherewithal, if they're able to be a B+ student, but they're not concentrating and focusing well, then their grades are going to drop, B-, C, D. And then if they have the disorder ADHD and are on appropriate medications to treat it, they should rise back up to that B+ student they were intended to be. The medicine never makes anyone smarter than they were to begin with. Of course, it just helps them concentrate better. So, standard of care, extended release, stimulant medicine, they work on the dopamine and norepinephrine neurotransmitter sites in the brain and help children concentrate. The way I explain it to parents a lot of times is, it's just like how we may need a cup of coffee to help us focus better in the morning and get our work done. It's very similar with children. So the primary side effects we worry about with stimulant medication are a potential for increased blood pressure, but that's rare to see in children, but a very common side effect of decreased appetite. Now, we encourage families to give the child their medicine after they eat breakfast in the morning. So the breakfast is their normal appetite. It's lunch mostly that you're going to really get a decline in the appetite. We try to make up for it with a big afternoon snack and a large evening meal, maybe a bedtime snack. Then that brings up another common question. If we're very worried about the child's weight and they are having poor weight gain due to the appetite suppression from the stimulant, then we would recommend not giving medicines on the weekend or fall break, Christmas break, spring break, summer break. Now, that varies. Do you remember how I said one of the characteristics for ADHD is impulsivity? Well, because of the impulsivity, think about how that could manifest itself to a child on a playground setting or even with their siblings. If they shout out something, if they say something before they think about what it may do to the other person's feelings, that's an ugly dress. Your hair looks bad today. Why'd you do it that way? You're stupid. That's going to hurt the other person's feelings, whether it's their sibling or a kid on the playground. They're often very poor at waiting their turn to go down the slide or whatever it is, or they blurt out their choice for which game the group should play. And so they're just sometimes not really fun to play with. So some parents, for sibling relationship purposes, do need to use medicines on the weekend or over breaks. Also, occasionally children can have stomachache or headache as a side effect of their medicine, and if they're just not used to it, every Monday they'll have that side effect. So for some of those children, the parents will choose, and it's fine, to use the meds through the weekend so they never have a restart day when they can have those side effects, and that's perfectly fine. But many children only need it for school days when they need to concentrate and focus. So over the summer, may be able to go months without meds unless they're in maybe a computer camp or a math camp or a reading recovery course over the summer, and they need that medicine to help them concentrate just for that little course. That's totally fine. Okay, so also let's talk about things you can do for ADHD that are not medication-based. Some of those are for home and for school, and the teachers are trained in this. For children who are identified as ADHD students, they often do better near the front of the class because the teacher can help redirect them and help them focus on things. They often do better in a very structured classroom. They need to know very clearly what expectations are for them and for their behavior. So behavioral management plans can work well in these situations. Now, things you should know, and the classroom teacher probably already knows this, but at home, if you give your child a long string of directions, they're not going to remember all the things you told them. So they may you may perceive it as disobedience when they don't do what you said, but they just couldn't remember all the things you said. So for example, let's say you said, hey buddy, I need you to go back to your bedroom, go ahead and get your clothes on and make your bed and brush your teeth and straighten up your toys and come out. It was too many things. They didn't hear all those things. They couldn't focus and concentrate and remember all those things. So you learn to give your child one direction at a time. Hey buddy, go brush your teeth. You may need to look him straight in the eye. You may need to hold his little shoulders, have him repeat back to you. What did mommy tell you to do? Go brush my teeth. That's right, good job, go brush your teeth. And praise him when he follows that command. So I would say having the diagnosis of ADHD is helpful for parents as well, because you need to know to have a little extra grace and not to give them those long string of commands, and they may fail and feel bad about it when they never meant to, and they never meant intentional disrespect or disobedience. They just couldn't remember all the things you told them to do. But I need to also specify, a lot of times I'll see children in the office and they are blatantly disrespectful, blatantly defiant, and oppositional toward their parents. That is not just ADHD. That's more than ADHD. That's inappropriate, and they need to have consequences, and that may require, you may need some parenting courses to help you build your skills with dealing with them. They may need some counseling for oppositional defiant disorder, and ODD is an actual diagnosis of its own, and often we end up referring for behavioral counseling or therapy. So we have covered a lot of information with today's video. I hope it's been helpful, but basically I want you to remember that ADHD is a real thing, but it does deserve an actual evaluation for diagnosis, because medications, while extremely helpful in many cases, can have side effects. And remember, your individual pediatric office they should have very specific protocols. Once meds are diagnosed, we need to see that child back for very routine follow-up to track the improvements, hopefully, the benefits of the medicines, but also to track growth, height, weight, and blood pressure, and kind of track their body mass index. So I hope this is helpful. That was very brief. Thanks.